Hi, I'm here with Dr. Marcia Prengruber, Director of the University of Bridgeport Naturopathic School of Medicine. And we're here today to discuss legislation that's before the Public Health Committee in which there would be a limited, reasonable expansion of the scope of practice. And Marcia's here to discuss this.
Hi.
Hello.
Glad to be here.
Thank you.
We would love to see a expanded scope of practice that would allow us to have our graduates practice what they're trained to do, just as they are in all of the other naturopathic schools. Our formulary would allow us to prescribe for those areas that patients often have to be referred back to their primary care physicians. If they come and see us and they have an infection that would be best taken care of by an antibiotic, for example, then instead of having to come to us and then go to their primary care physician and then come back to us, this would allow us to do that. We will still refer to our primary care physicians for all of those things that really are appropriate for them to be taken care of. We do not want to step outside of our scope, but rather to be able to help patients reduce their cost, get their health care more easily and quickly by seeing their naturopathic physician.
I truly believe that people are just becoming more educated as to their health choices, and preventative care being the most important aspect of what naturopathic medicine provides, in which there is a collaboration between the patient and the doctor to ensure that wellness is maintained throughout a person's life. And all this bill is asking for is just to have a better standard of practice, so that patients can have these choices and stay with a naturopathic physician if they so choose.
That would work ideally for both the patients, and with the shortage of primary care physicians, we can help to fill some of those needs with the ability to prescribe for some prescriptive medications. I think that we've established good relationships with many of the medical doctors and osteopathic doctors in the community. We just need to be able to provide the opportunity for the patient not to be jumping back and forth and to increase their costs that way. So when we have the need to step beyond those less invasive, less toxic approaches, using nutritional supplements or botanical medicines, sometimes we need to go beyond that. And with an established patient, it makes perfect sense to be able to just take the training that students have had and be able to use that in their practice.
Yes. So how many states allow this type of formulary to be prescribed?
They vary significantly in terms of the amount of formulary, but if we look at a state like Vermont, for example, which has a very full prescriptive authority and has done very well, there haven't been concerns with inappropriate use in terms of malpractice claims, none of that. So it's been a very successful opportunity. So our students are trained here in Bridgeport, and then they move to Vermont.
Yes.
To be able to practice.
Yeah, unfortunately that is the case, and of course it's state government's interest to retain these people, that they stay in Connecticut, and there isn't this brain drain leaving Connecticut.
Surely we want to keep the people that we have so well trained and provide them with the opportunity to meet the patient needs in the community.
So not only is this good medicine advancement, but it's also good economic development, not only for the city of Bridgeport, for the entire state.
Absolutely, absolutely.